So you talk about what makes your work unique. I mean, I'm getting a sense of it by what you've shared so far, but you don't sound like the normal oncologist that I've interacted with. So what do you do that's unique in your work that's different from other people?
So I think the unique vantage point stems from my background. The question you asked about, tell me more about who you are. I didn't answer that question specifically because it's a very difficult question and it has multiple layers. So who we are as we all sit and stand here, as we all occupy this planet called Earth, right? Who we are, we have a core, right? And then that core is enriched by our experiences, good and bad, right? And our perception of those experiences, what we gain from losses, right? And adversities. And then, of course, it's also informed by the people who I call dispatched and disguised, who influence our lives, right? So those are the angels, but they're dispatched and disguised, because they're disguised as people, but they're really or guiding angels, right? And so who we are is a collage of all of that, right? And so I think that because of that collage, my unique vantage point is as I have divulged, right? So that is what influences, that is what has inspired my vantage point. So the adversities, I mentioned I'm from Jamaica, and so I'd like to just expound on that. So my mom died when I was 13. My brothers were also teenagers, and we were living in Jamaica at this time. And they basically took care of me. So they had that mantle that you can deduce what you want to deduce from that my brothers actually had to take care of me. But my mom, before she died, she had this vision. She said, and we'll never forget it, very profoundly, she stated, she said, well, I have prayed, and I'm a believer, mostly because of what I've experienced in life. And she was too. And she said, the foundation that I've given to all of you, I think with His grace and my faith, as I leave this earth, you will all be successful. And at the time, as a 13-year-old, and my brother was 17 and the other was 19, we're thinking maybe her cerebral capacity is also being affected by this disease, because I'm not sure what our future holds right about now, but with you not in it, it's not looking very promising, right? But I have learned from her that vision is powerful, right? And expounding that vision, actually disseminating it, is also powerful, which is what I do. Because you see, we are all connected, which means that my vision, right, as long as I execute based on Persian and Papa's, that mission that has been fueled by my vision, right, then it's a catalyst, right? Her vision served as a catalyst, right? So then that's a catalyst for me now to ignite your vision, someone else's vision, so that they can therefore perform their mission, so that they can be the catalyst for someone else's. So we're all connected. So when I see patients, I can't just see them as patients. And there is a, and I know I'm probably going off topic here, but I think it's intertwined somehow. As I said, it's all connected, both virtually and literally, right? I consider my consultation with patients as a mandatory meeting of strangers, because it was ordained, right? So then why am I here? And why are you here? Why were you assigned to me? Because I travel all over the country to treat patients. But here I am at this point in time, right? And here you are. So therefore, I am here for a reason. And so I can't just be here, you see, in the space and time just to treat your diagnosis. I have to go beyond that.